it's the 72nd birthday of Britain's National Health Service, which once upon a time was the jewel in our crown. It was a model which other countries envied or emulated. But as it reaches 72 years old, it's more than creaking under the weight of the so-called reforms and the financial punishment which it has taken, especially over these austerity years since 2008, a long time in anybody's lifetime. So who better to say happy birthday to than Dr. Ranjeet Brar, physician and surgeon and MOATS' own medic. Dr. Ranjeet, thank you very much for joining us again. We'll come on to the NHS more generally, but you'll have heard on our news bulletin there, the last 24 hours has been a world record for new coronavirus 19 cases. The best part of 250,000 new infections in 24 hours. This isn't going away, is it? In fact, if it ever did go away, it's coming back with a vengeance.
Thanks, George. Pleasure to be with you. And I will say happy birthday to the NHS, and we'll come back to that question, as you say. But you're quite right. The NHS is facing really a kind of perfect storm in terms of the prevailing systemic conditions, and the coronavirus certainly has a part to play in that. Looking at the world, there's been 1.5 million cases since we last spoke 1 week ago, George. So we're coming up now to 11.5 million cases in the world, with over 540,000 deaths. And as you say, every day in the United States now, it's really running rampant out of control. And of course, both the US healthcare system and the Trump administration, as well as the federal structure of the government, without clear guidelines as really who's to take responsibility for controlling the pandemic, has had a huge impact on that. But more than 55,000 cases every day for the last 3-4 days is a huge toll. But of course, then we've seen increasing impact in the third world, in the BRICS countries. Brazil now has over 1.5 million cases. India has recognized that it's got 700,000 cases, probably has many more, and still not accurately recording either the number of cases or the number of deaths. So, as the testing increases, we'll find more and more of the virus, no doubt. But equally, it's true to say that the virus is really running rampant around the entire globe as we speak, George.
And there's no sign yet of anything meaningful we can do about it, unless, of course, one is lucky enough to get one of the US purchased prophylactics, which they have purchased. Virtually every single unit in the whole world has been bought by the United States. The drug companies will charge a king's ransom for those. There's no guarantee that they'll save your life in any case, and are only useful if you're already suffering from it. No vaccine. This is quite a frightening time to be squeezing into a crowded public house, isn't it? Or filling the streets of Soho in London with thousands of people drinking and carousing.
Several components to your question, George, and all of them are quite powerful and valid. This drug, remdesivir, which is a nucleotide analog, so it's a bit like an RNA molecule, but doesn't assemble correctly into the genetic structure of the virus when it's reassembling. It's been trialed and found to slightly reduce the duration of illness, but not actually reduce the total mortality of the disease. So it does have probably some effect, though actually the randomized controlled trial, which led to its adoption in the United States, has been widely criticized. There was a paper I've just read in the BMJ which criticized it as having a lot of loss to follow-up, not following up all of the patients, the trial being poorly randomized, and so basically poorly conducted, and then drawing a question mark over the results. Nevertheless, let's assume that it's correct and it does have some positive impact. It's very telling, really, that the United States is supremely arrogant. I mean, the United States for a long time has essentially conducted its foreign policy on the basis that the life of an American, it doesn't have parity with the life of human beings elsewhere. There's lots of evidence to attest to that. But certainly if you think that the United States, when they thought there was a vaccine that might be developed, Trump tried to buy up that company, even though it was a German company, so that and give exclusive use of the potential vaccine to the United States. And he's done a similar thing with Gilead, who produced this drug. This drug is actually produced in California. Gilead have a limited ability to produce it. You can look at the workings of capitalism even further and say, look, Gilead's share price has gone up 20 to 30% within this pandemic, precisely because there were hopes for this drug, and this trial, which is probably poorly conducted, has boosted their share price still further. And more than that, if you look at the special laws surrounding drugs, they were very keen to get something called an orphan drug status for this drug, which essentially is something that they would normally roll out for a drug for a very rare disease, to ensure that they're the only people who are allowed to produce it for 7 or 8 years, and therefore they're going to reap back the full profit. Now, in a pandemic, it's hardly a rare disease, it's a worldwide crisis, but they want to limit the profit to their own company, but that would mean also obviously limiting the treatment offered to the world. So you can see what motivates, on the one hand, these massively lucrative enterprises. They're solely concerned with the profit they can generate from this world crisis, rather than come up with the best way to tackle the health emergency. And that is very typical, and we've seen that roll out in many different ways during this pandemic. But coming back to the latter part of your question, is this a good time to be easing lockdown? Look, the rates are down. Leicester is a particular case. And again, you can see the poor response of the NHS has been conditioned by those pressures of privatization that you were talking about. If we look at testing, it's been Deloitte who's been in charge of the testing. We look at tracing, it's been Serco who've been put in charge of tracing. If we look at the PPE and the Nightingale hospitals, it's been a coalition of KPMG and or consortium rather of KPMG and Deloitte. So this COVID-19 laws that have gone through on the back of the emergence of the pandemic and the closing down of Parliament, together with anyway the proclivity of the current government and previous governments over a long period of time to increasingly farm out the responsibilities of the health service to public care, albeit under an NHS, to private care, albeit under an NHS guideline, has led to a very disjointed response where, for example, in Leicester, the local council was saying they didn't realise they had that many tests, precisely because actually a large number of the private tests are in fact farmed out to another private company, which is the Lighthouse Labs, in conjunction with Amazon, with Boots, with Royal Mail. So a whole consortium of private interests are coordinating in a very loose way, which is leading to very poor sharing of information and no single body. And certainly, it's led to a system of kind of a feeling of despair within the NHS staff that they actually, despite having the expertise to deal with the pandemic, don't have the power to reorganise their health service and actually manage the government response in an appropriate way, George.
That was a dazzling description of where we are. Where would you prefer we were, or prefer we were heading to? This is the birthday of the NHS. Let's hope it has many happy returns. But for them to be happy, what needs to happen, Doctor?
Well, George, I don't think that we can trust the National Health Service in the hands of governments who, over a 40-year period, have made it very clear that their intention is to privatise the National Health Service. If we look back at the Thatcher administration, John Redwood and Oliver Letwin published a document which basically was about how to privatise public services, and particularly focused on the NHS. And that document was called Britain's Biggest Enterprise. And they have an absolute will and desire to turn over all of the money, very considerable revenue of the state, to private companies, and that would involve privatising national services, including the National Health Service, amongst others. It's particularly the case with the National Health Service that it's under persistent pressures to try and farm it out to different providers. The idea initially was to just get peripheral services, so, canteen services or hospital maintenance services. But it's been gradually picking away at the pie until actually a huge, probably the majority of the National Health Service is privatized, and a whole variety of groups provide services, including peripheral and core medical and incidental services. Consortia of private finance initiatives of banks take huge chunks of the NHS capital. Drug companies obviously take huge amounts of the capital. So this is the pattern, and far from reversing that trend. It was during this pandemic, it's been used to further push that same agenda. So how can we stop it from happening? Well, first of all, we need to realize it's happening. I still would recommend all of your viewers, if they've not watched it, to watch Bob Gill's excellent movie, which is available on his channel, which is about the privatization of the NHS. And it's a fantastic film, and we'll put the information up and I hope people will watch that. So becoming aware of it, they can get him to come and speak at local events and see just how this is being done. But increasingly, it's clear to me that there needs to be a broad public campaign of the use of the NHS themselves. There's no doubt that that the clapping for the NHS is very sincere, it's very real. If we go back to the 2012 Olympics, when we put on a huge show, really, of the world of just how proud we were of the NHS. I know people who were involved in that. Britain has shown how grateful it is to have this facility of caring for our sick and our needy when we most need it. But if we don't step up to defend it, realise the ways in which it's being challenged, whittled away, eaten away, I'm afraid to say that we're going to be left with a system which looks very much like the US system. And if we look at just how that COVID pandemic is running rampant, out of control in the United States, you realize just how inefficient it is. It's the most expensive healthcare in the world, and it's the most inequitable, and leaves a vast number of the population, at least 60 million people, without any healthcare whatsoever in the richest nation on earth. And that is not a model of healthcare that we want to see. Our healthcare is no longer run by the government. It's been farmed out to a quango, a quasi-autonomous non-governmental authority led by Sir Simon Stevens, and that's NHS England. And it's NHS England that we recently found out this week was actually watching the figures, which had issued instructions to discharge patients with COVID from hospital into care homes to create beds in the NHS. And they became aware, and they were watching an increased rate of infections within care homes. And during this pandemic, they say 66,000 people have died within care homes. They say 20,000 of them from COVID, but many of those will be without testing, so that numbers could be far more. So there's gross mismanagement. It's not, the management of the NHS is not being run by the clinicians. There's a constant mantra every time they introduce a new wave of privatization that is about clinical excellence. It's about putting clinicians in control. But I'm afraid it's a gross lie. Funding has been put out to clinical commissioning groups. Those clinical commissioning groups are groups of GP nominally, but they don't have the capacity to plan. They're increasingly put with groups such as KPMG and the big four accountancy companies, and American insurance industry, particularly United Health, is being invited in to oversee and run that, and is being driven very far down the line of privatization. It's up to the British people, really, to prevent that from happening. And the first step to that is an increased knowledge and vigilance, George.
I'll be lucky to see 75, certainly lucky to see 80, unless these things are reversed.
I think that's right. I think there is a campaign to try and address certain issues of it, particularly the NHS, the Health and Social Care Act 2012, which was an act which removed the responsibility of the Minister of Health for providing healthcare to all Britons and transferred that over to this quango, NHS England. It also advanced the privatisation agenda in other ways. And I certainly think we should, I think in line with your poll that you're running tonight, George, demand the end to the profiteering from the private finance initiative. They've made their money several times over already. It's well within the ability of a government to cancel that source of debt at a stroke, and that would be to the great benefit of every citizen of Britain. It's something that we should all get behind and demand of our politicians.
Bravo. Thank you very much, Dr. Ranjeet Brar, MOATS medic, who has helped us through this entire emergency.